Itu yang bisa kami sampaikan. Mohon maaf apabila ada kekurangan. Kami akhiri. Terima kasih banyak. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih Pak Wadid. Selanjutnya kita sampai kepada acara inti yaitu kuliah tamu. Sebelumnya kami persilakan kepada moderator untuk memandu kuliah tamu kita pada pagi hari ini. Pada Dr. Fitra Latifah, kami persilakan. Baik, terima kasih kepada MC yang telah memberikan acara kepada moderator. Saya Fitra Latifah akan memandu kuliah tamu kita pada hari ini. First of all, hello. Yes, Prof. Yes, okay. Hello, Prof, Dr. Anwar and Pak Budi. It is a pleasure for me to guide this guest lecture, and this guest lecture will Prof, Dr. Anwar and Dr. Budi will provide us an insightful talk about AI. As we know that we almost use AI every day, not only for education but also for our medical activity, our daily activity, and so on. And it's not almost every day we use AI. And then, as a rapid development of artificial intelligence, we should know that we should use AI properly. Then, Mr. Prof, Mr. Ahmad, and also Mr. Budi will tell us about how to use AI properly, from the development of AI, ethical consideration, and also future direction of medical education in use AI. And first speaker is Mr. Prof. First of all, let me introduce you who is Prof. Prof is a professor in the Department of Biomedical Science of the Art of Medicine and Life Science and University. His basic is clinical pharmacist, and previously he is worked in health ministry in Malaysia. And then his education background, PhD in University of UK, Master of Clinical Pharmacy, University Science Malaysia, Bachelor of Pharmacy in University Science Malaysia. And his research interests is in health economic, regulatory affairs, pharmacological science, and digital health. And to the problem, is yours.
Thank you so much. So I'm very excited to be here. Thanks everyone. Understand also the audience consists of medical students and also veterinary students. May I know who is medical student? Medical student. Oh, good. Dentistry. Okay, no worries. I see. Okay. But first of all, I think I'm not last. So quick.
Bisa Kak? Ya alhamdulillah. Oke, lanjut. Isinya Kak. Tetangga saya sembarang Kak, nah gitu. Ini.
slide shows the
Oh, tidak. Dah. Iya, dah.
for the
Oke, Kak.
okay. This okay, I want to see. So our research at some university also focus on the medical educations, looking at the impact of AI on the medical educations.
Ada
And
bang
it
foto
is
tahu tangan bang lah.
it also
Foto tahu tangan bang lah
contains
ini.
both the promise of the AI and also provocations of AI in medical educations. Promise means something good, provocation means something negative. So promise means the technology we are discussing, as pointed out by the chairperson just now, we are siapa lagi yang tak pernah pakai generative AI? Anyone have not used it? I believe everyone has used it, isn't it? So that's not an issue anymore. Okay, it's either how we use it or are we using it ethically. Okay? That's also very important. Okay? So provocations, because just like what the Spider-Man said, with great power comes great responsibility, isn't it? Also, with the huge potential of AI, it also has potential for misuse. Just like antibiotics, you prescribe antibiotics for treatment of patients, but antibiotics cause antibiotic resistance. Both sides. The medicine you are giving to your patients, at overdose, it can be a poison also. Same thing, AI, you must know how to use correctly. So let's go through what we're going to cover today. So I'm going to cover from number 1 to number 6. So first of all, I'm going to look at also. So module 1, we are going to describe what is GAI, generative AI, also, which is we need to know what is large language model, how by understanding how it operates, okay, we can understand how it can be applied in our okay. Module 2 take into the applications, example how simulated patients can help you in your Module 3, we look into the benefits of using this AI, okay, in educations. So number 4, look at the risks and also the gaps of using this AI in medical educations. Ethics is also very important. Okay, we come across also at our universities, students have been failed because didn't declare the use of AI in assignment. Okay, so the students, we have to fail the students because of that. It's very important. Okay, and also we talk about how this thing can be fully integrated and what is the future for you, because currently maybe you are year 1, year 2, year 3, and you still have a few more years before you can register as a medical doctor. Okay, this is the papers that I published together with my colleagues. As you see, this one we published in JMIR. Okay, this is in 2022. Okay, 1 year after, so the ChatGPT was first introduced back in December 2022, and there's causing a lot of traction or a lot of attention. People have been using it, so that's why our discussion today also based on this particular paper, which you can download. I'll share the slide with the organizer later, which you will have access to the slides. So it's very important to look into the integrity of using AI, which is I keep on stressing again and again. Okay. So let's take a look at generative AI. Okay, this is not just a definition, okay, but the AI today have a very specific, it's a AI is a very specific term system, okay? It's a large language model or sometimes called LLM, okay? So just like in the ChatGPT now it's using ChatGPT 4 or even 5 now, okay? So we are not just retrieving the system itself, okay? We are not using it just like a chatbot, but we need to know how to optimize the usage, okay? Okay, if you see this particular slide, okay, I show different type of generative AI, okay? From large language models up to medical specific AI. Okay? So let me just quickly walk you through. Okay? Let's take a look at the first one. Okay? The large language model, which is the first one being introduced. Okay? So this large model processes and generates, just like for example, Gemini using when you type in some messages and can come up with some responses. Okay. So for example, if you put in some medical part, what are the differential diagnoses for acute chest pain? Okay. Then you will come out response. Okay. So let's take a look at multimodal models. What is this? Multimodal. So these models handle multiple data types simultaneously, including images. So these particular models, when you put in images, like for example your X-ray, it can tell you accurately the difference diagnosis or potential diagnosis aligning with what radiologists have been taught with. Okay. So the third one is diffusion models. These diffusion models can generate images or synthesize X-ray, histology slide, and anatomy illustrations. So it will be good for your producing education material for student learning. Okay, the last one, this one is very applicable for you as a medical students or veterinary students because this medical specific AI system, okay, for example, biomed LM, okay, it trains specifically on clinical facts and medical literature, your electronic health records, okay. So it is very specifically for medical student use, okay. So you can check out this biomed LM or clinical purpose, okay. Okay, let me just quickly show the current landscape or development of this AI in medical education. So it started way back in 2017, and then fast forward, okay, within 8 years, tremendous improvement have achieved in terms of now we can in fact use AI in, for example, diagnostic purpose. I'll show you some example later. Okay. So this one, there is a survey conducted by American Medical Association. They found that 80% of medical schools are already using AI. This is back in 2024. I think by now, 2026, almost 100% are using. Okay. Okay, so anyone that doesn't know who is Elon Musk, okay? Everyone know Elon Musk, isn't it? The owner of Tesla and also currently ranked as the richest person in the world. So he's also a genius in himself advocate the use of AI. So according to Elon Musk, in the January interview, he said that this Optimus robot, which is a robot we use for surgery purpose, okay, it's robotic surgeon. Okay. Within 3 years, okay, he foresee that the skills, okay, the techniques of this AI robot will be better than human. Okay. So it will be the first choice if going for surgery. So does it mean that the AI robot will be replacing a surgeon, human surgeon? Okay, it's question mark. I will elaborate this further, but I want to quickly show you one very interesting competition also. So just recently, China also invested heavily on the AI. So they created a gastroenterology AI large language model. So technically, they imported all these GI gastro cases to the particular ChatGPT like models, and then they come up with competitions. Okay, they put two group of competition. Sorry, two groups. One group is the four medical doctors, four specialists, gastro specialists, compete with computer. So these two people, they are the ones who control the computers, the AI models. So who do you think wins? Who can come up with the most accurate diagnosis fastest? Okay? Anyone who think human win the race or competition? As you can see, the just now is the AI actually won. So the AI perform faster and more accurate than these four specialist doctors. You know why they are putting on mask? Rasa malu lah kalau it come out in newspaper, people will ridicule them or people will they put on mask just to make sure that their identity is being disguised now, okay, so that people won't recognize them. Okay, these are real four specialist doctors wearing masks just to walk. They don't want to show their identity. But in these competitions, they lost to AI in terms of accurate diagnosis, okay, in terms of speed and accuracy. Okay. So it shows that in terms of diagnosis, okay, specialized AI models is been proven good in this competition. Okay. Okay, let's move on to the second module, applications of AI in medical education. So in previously we learned what is generative AI. So now let's take a look at what medical AI can do for you as a medical student. Okay, please take a look at this particular AI patient simulations. Okay, I give you maybe it's too small. If it's too small, maybe you can sit forward, sit in the front row so they can read better. Take a look at this case simulations. So here you are as a student itself, you need to ask correct question to the patient, which is the AI patient, okay, so that it will simulate the real patient scenario, okay. So by asking the correct questions, then you can come up with the diagnosis, okay, isn't it? So now you ask sharp or dull pain, you have a cough or fever, and then the simulated patient's answer is I'm having sharp pain, scale 7 out of 10, no fever, but the patient has been coughing, and then the patient also saying that traveling frequently for work. Okay? So from here, you should have some preliminary diagnosis or impressions of what will be the potential diagnosis and then what diagnostic test you want to order for the patient. Okay. So here, based on the conversations, the AI suggested that patient might have a pulmonary embolism, and then you need to also do the event thrombosis risk factors. Okay. So that is very important for you to think. Okay. If it's a pain or is it a which particular area, does it come with any other symptoms that you need to rule out? Okay. So these key capabilities is very good for AI because you can have access to AI learning, not just in the classroom, but at your own, by using phone wherever you are. Okay. So this is already being practiced it's already available. This software, okay, AI simulated patients. Okay. So one example is this one, Stanford Osiris AI tutors that was started at the Stanford University Medical School back in 2024. Okay. So they have done this case study among year 3 medical students. Okay. So anyone in year 3 now? Year 3 medical students? Take your hand off. Okay, year 3 medical students, okay? That's good. So they have done this and then they found out that out of these students, 87% of these students prefer AI simulations for practicing. In this case, they have used these rare disease cases. Why they prefer? Because the real standardized patient actor sometimes might convincingly portray pneumonia patients, but can't really portray a patient with primary medical modules for infectious disease. Okay, we want to know how the lecturers' perceptions about AI. Okay, so from here, our conclusion is yes, the lecture notes and curriculum can be enhanced using AI, but again, must with cautious. That means oversight and counter checking by human are equally. Okay. Okay, let's take a look at the fourth modules, looking at the risks and gaps and critical concern of AI for medical education. Okay, so further experimental work have testing have done. So what they have compared using this one quite some time ago, ChatGPT for performance. So they uploaded the exam questions to ChatGPT, and then they found out that they can answer very well. Okay, for pharmacy related modules, AI can score almost 71%. For general medical modules, AI can score 70%. Nursing, almost 62%. Okay. What's your average score? Do you score more than 70% for your exam? Okay, are you doing better than AI in that case? Okay, bear in mind this is just general ChatGPT. This is not specific medical chat, like just now the BM medical educate. Sorry, BM medical education module. Okay, so this is just general one. The specialized AI module for medical students can score even higher. Okay, so that means that at the AI era, you should work harder to learn the real knowledge, not just relying on AI, because the patient will have access to all this chat GPT, and patient can be equally smart as you now because they have information directly from AI. Okay, you need to outsmart. So again, this is sometimes we think that there is possible hallucinations that hinder clinical reasonings. Okay, so this one just show that when AI advice is correct, okay, there's almost 6.3% of a net impact on accuracies. Okay, so slowly also the you need to do. Okay, this is just example. Okay, so pathway A is the safe path. Okay, pathway B is the hazard path. Okay, what does it mean here? I want you to take a closer look at this particular figure. Okay, which one you should follow when you use AI? A, isn't it? Pathway A is more accurate because let's say if the AI advice is correct, okay, but if incorrect, the information was even worse. Okay, so you shouldn't blindly accept the AI differential diagnosis. Okay, because sometimes hallucinations still might occur. Okay, this is for example uh, wrong diagnosis, pneumonia with endocrine disorder. Okay, so which is 100% direct harm to the patient safety. Okay. Okay, this is another cases showing the AI hallucination in clinical context. Okay. Sorry, the font is a bit small. Okay. If you know your pharmacology well, have you learned endocrine disorder, especially diabetes mellitus? Okay, you know roughly what is the first line of treatment, isn't it? Medical treatments, metformin, oral metformin. What is the starting dose of oral metformin here? So if you see from here, the AI have in fact given the wrong dose, okay, 1,500 milligram, but it should be start with 250 or 500 milligram and then titrate slowly, okay, because the metformin also give a lot of a GI side effect, for example, nausea, diarrhea, okay. Titrate up is very important. So by textbook still is very important. Doesn't mean that you can throw away your textbook. By you need to also know how to find the correct answer in case AI given you a wrong answer. Okay. Okay, that's risk number 2 here shows AI algorithm bias in medical AI. Okay. Because let's say, for example, in the particular software, if the training data set is wrong informations, automatically the answer will be wrong. Okay, there's a saying say rubbish in, rubbish out. Okay, so the training data set is also very important. Just like, for example, if a lot of people, when they use AI, they uploaded the wrong information to AI. AI will perceive that is the correct information. Okay, so policy vacuum, surprisingly now, there is not much latest updated guideline, okay, that about this, because AI have been progressing very, very fast paced, and then the guidelines that have been issued previously, like last year, might not be applicable now, okay. Okay, so this is one example of misdiagnosis incidents that occur because the one of the medical doctors using AI in their training. Okay, so it come up with a lot of issues. So lucky for them is there's a indemnity insurance, but that also they have to go through the legal dispute. There's a legal dispute. Okay. Okay, let's take a look at the module number 5, ethics, transparency, and framework. Okay, what is the authorities or education department are doing in terms of making sure the correct guidelines is in place? Because just now I said the guideline might be updated, isn't it? Okay, so let's take a look this American Medical Associations, which is AMA. This one is the largest physicians organization in the United States. Okay, they have fully recognized the urgency of how AI have transformed the medical education, medical practice. So in 2023, they published an augmented intelligence in medicine policy framework. Okay, so they have 4 domains here in this particular framework, which you can read. You can download. First one, let's look at the foundational AI knowledge. Means that the practitioners must know how to use AI. The medical practitioner must know how to use AI. The second module, domain, clinical application of AI. How it should be tested in the real life patients, and then to confirm that it is safe for use. Domain 3, ethics and professionalism, which we will go through shortly. Okay. Number 4, quality and safety oversight. Okay. Who to be blamed? Okay. If let's say AI suggested drug A and then you have given drug A to the patients, who should be responsible? AI or the doctors? Okay. Anyone thinks AI should be responsible? Still the human have to bear responsibility, because ultimately you are the one who prescribe the medication. Okay, so this is the UMP and the Indonesia Higher Education Guidelines. Okay, so there are 3 main points here. Okay, academic integrity, ethical use have been covered, responsible integrations, training should be given, accreditations and administrations in terms of proper documentations, and also data security to prevent that, for example, if, let's say, is it allowed or not for lecturers to assess your assignment using AI, because would it cause AI to keep the document that being uploaded? So that is one aspect. Okay, so this is the my very last module on the human, how human and AI, you as the medical doctors and the AI can have a symbiosis, integrations. Okay, so let's compare you as the human physicians. Okay, when so our attentions and recognitions also have its limit. Okay, but AI, the advantage is it can have a skill and speed in terms of processing data, okay? Because I'm not sure whether you have seen a supercomputer which they have a huge, large CPU compartment, okay? AI will, as long as there's electricity, it can continue to work, isn't it? But humans, if you work on call continuously, okay, the chances of error might occur, okay? So that one we cannot win AI, but we can overcome our weakness, okay? First by, we know how to empathize, we understand human emotions, okay? When there is, for example, the patient expired, or let's say during the delivery, the baby died, okay? How you want to review the bad news to the patient? You will not ask the patient to get the information just from a message or from robot, isn't it? You still have to deliver the bad news in the best way to the patients, okay? Ethical accountabilities, okay, as I mentioned just now, you have made the right choice, saying that the human still have to bear responsibilities, and also understanding unspoken social dynamic. For example, looking at your patient's eye movement, facial expressions, a lot of things are unspoken. So that human can detect better, but not AI. Okay. Okay, let's take a look at the one interactive case. I have an NCQ here. So can you look at this case and then tell me what is your answer? I give you 3 minutes.
Oke, adik-adik boleh menjawab pertanyaannya ya. Diberikan waktu 3 menit untuk berpikir terlebih dahulu. Kalau ada yang mau menjawab boleh nanti ditunjuk tangannya.
Yes.
Oke, silakan Sami.
Sorry. B, yeah? B, yeah? Yeah, very good. What's your name? Sami, yeah? Yeah, well done, Sami. I think we should give you a big clap to Sami. So it's correct. Well done, well done. So, yeah, the AI actually missed the travel information related that they need to take into account. There is potential travel related diseases, like patients go to forest islands, the Kodomo Islands, and then which have higher chances of potentially getting malaria, okay? So they need to rule out that before, okay? This is my last few slides. So key takeaway, let me just walk you through some very important message. So the AI is a tool, okay? It's not an oracle. I'm not sure whether you have watched this Matrix, the movie Matrix, okay? So you must always doubt, okay? You don't let AI replace you, okay? Number 2, verify everything clinical, okay? Context is everything. You need to understand the patients holistically. For example, just now patient travel to particular places, what are the potential risks from that exposure, okay? Active advocate, okay? Push yourself to embrace it, okay? Join all these communities to learn more, okay? Never lost the human touch. Don't just send things through messages, email. Sometimes call, face-to-face interaction is more important. If you use messages, it will take days for you to solve a problem that you can just talk to your patient in a few minutes, okay? Keep learning. Same with ourselves, we still keep learning also. Now is a very exciting era to live in. There's so many new AI coming in. This is just the beginning of AI. In the next few years, there will be more applications that we cannot imagine. Okay, if, I just want to highlight also, there's this new, not new also, have been introduced by Google, Notebook LM. You can watch this video also. It's very interactive. Let's say you upload one textbook, ebooks, by looking at the chapters, you can extract information, and then you can do mind map to self-test it. Okay, you don't do the mind map. Don't use their mind map. You do your own mind map first, and then you compare. Okay. Okay. So will you be replaced by AI? Okay. This is the questions. This is based on the New England Journal of Medicine's AI editorial back in 2024. Okay. So the AI will be replaced by physicians who know how to control AI. That is their conclusions. Okay. So once again, take this opportunity to congratulate your UMP teams, Dr. Budian, Dr. Rivan, again, yeah, for this great achievement, being ranked #1 in medical and health in the whole Indonesia. Out of these, so many, more than 70 medical schools. Okay, excellent news. So keep it up, the good work. Okay, there are some references also which you can go through, and also I will share my articles that I have highlighted just now with the organizer. So that's all for me. Thank you so much, everyone.
Yes. Okay, thank you so much, Mr. Prof. Long. Thank you for the insightful presentation. So after this, we don't use AI, not just for we ask and they answer it quickly. And after this, we do not use it just for a chat bot, but we should optimize using it. And in the future, don't let AI replace us. And next, we invite the second speaker. The second speaker is Dr. Amar Daud Iskandar Abdullah. Dr. Amar will present about precision neuroprotection from molecular targets in brain injury to the era of omics and data-driven therapeutics. And let me introduce you, Dr. Amar. Dr. Amar is a neuroscientist. He is in the Department of Biological Science, School of Medical and Life Science of Sunway University as a senior lecturer. His education background, PhD in Neuroscience, University of Melbourne, Australia, Master of Science in Cell Biology, Korea University, South Korea, and Bachelor of Science in Biotechnology, University of Malaya, Malaysia. To Dr. Amar, time is yours.
Okay, thank you so much, Dr. Atifah, for the introduction. Also, I would like to thank everyone, Dr. Budia, and all other faculty members for inviting us today. Building area, sorry. So I'm also half Indonesian, and my mom is Indonesian. She was born in Tanjung Pinang. So today, I would like to sorry, not too close, right. So, thank you so much, Dr. Rivan. So I would like to show you a little bit of what I do, right, as a neuroscientist. At the moment, I'm working at Sunway University, Malaysia. So I'm actually doing traumatic brain injury study in my research, right? So I would like to, like Dr. Budi explained just now, because you guys are all doing medical, right? So you might be interested in doing research. So hopefully I can share with you what I do as a researcher, and hopefully it will be inspirational. All right. So what is traumatic brain injury? Right. So it's a type of acute brain injury, right? And it's a leading cause of death and mortality in the world. So this is a statistics in Australia. So far, a lot of TBI is caused by TBI transport accidents, right? Because of the motor vehicles crash. So this is how people get TBI. and it costs a lot of money, right? Because not just because there's no cure, but the management after TBI is also take a lot of care from the family of the patients, right? And this is why in Malaysia and I think in Indonesia it's quite understudied, right? So we need more scientists or researchers to actually study this brain injury. So acute brain injury like traumatic brain injury or stroke, and you probably know chronic neurodegenerative diseases as well, like Alzheimer's or Parkinson's disease, right? But I'm interested in traumatic brain injury. Okay, so in Malaysia, I did find some statistic, right, about traumatic brain injury in Malaysia. So similarly, the road traffic accidents is the major cause of traumatic brain injury. And I will give you a little bit of understanding how TBI patients are cared for, right, after somebody have got TBI in the clinics. But again, the TBIs is still need to be studied, right, in terms of the management care and also the cure for the treatment. In my research, I'm more interested at the cellular mechanisms that happening in the brain after traumatic brain injury. I will share with you later. Okay, so I tried to find some statistic in Indonesia just now. So it's similar, right? Most of the head injuries are happening in the young adults. So you guys are around how old? Students here? About 20s? Do you drive motorcycles? So you can see, right, actually one of the cases that are highly contribute to TBI in Indonesia involve motorcyclists, because you don't wear helmets, is it? Right. So you should try to be more protective of yourself on the roads, because that is a very important, I guess, first step of protections to make sure that you don't get traumatic brain injury. And these are the studies in by local, I guess, researchers in Indonesia. So you guys do have researchers who are actually studying this topic, I think, which is very good. Okay, so again, I explained TBI can happen to everyone. Elderly patients, people who are a little bit older, they tend to sleep, right? They tend to fall easily, and then they knock their head. So this is how they get TBI. But most of the time, due to the road accidents, right? And if people knock you on your head, right? Somebody just smack you on your head, you can get TBI as well. Can you imagine any other cases that might contribute to traumatic brain injury? What else can contribute to TBI, if you think about it? How about in sports, for athletes, right? Like footballers or rugby players, you know, they bump to each other, they knock their heads, so they get TBI. Right, so again, still causing TBI. Also military, right? How can military soldiers, all those militants, how can they get traumatic brain injury? Right, physical, maybe gun firing into your head. Also explosive, the sound, right? High sound, the blast can also actually create a TBI in the brain, because a very, very high frequency of sounds that travels to your brain, it actually causes a vibration. Because you guys study already neuroscience in your, I think year 2, is it? Third year, you do study. So some of you have studied, right? The, I guess, central nervous system and PNS. So you know your brain is actually covered by a skull and protective layer, but due to high vibration, it can still, all right, causing injury. Okay. So I've explained to you a little bit. So just to tell you, the damage in the brain can be focal, local, right, at the specific site of the brain, or also spread because of the high collision. For example, if you have a motor accident, your head goes back for like that, right? Very rapidly. So this also cause diffuse shearing here. We call it as diffuse axonal shearing. And all of these influence the integrity of your brain. It causes the breakdown of blood-brain barrier. You know what blood-brain barrier, right? It is a protective layer of the brain. So this can be compromised after traumatic brain injury. And there's also blood accumulation and hemorrhage. So this is an example of what happens after traumatic brain injury. Okay. Primary TBI, which is the first steps when someone's being inflicted by traumatic brain injury. What happens? What happens when you get hit, damage, get a physical, physical force delivered into your brain? What happens? Yeah, you have a hemorrhage, right? Bleeding. Your cells will die, right? They won't be able to be safe. That is actually the primary injury. But over time, it can actually spread, right? This is what we call secondary injury. So the primary injury, there's nothing much you can do, correct? Because the cells already die. But what you can do now is actually to prevent the progression of secondary injury. And these are the molecular mechanisms that are activated after secondary injury following traumatic brain injury, TBI. Okay, and this is why I'm very interested to understand how we can actually prevent the progression of secondary injury. So then you can minimize damage after TBI. Right? So the primary injury can actually develop minutes, days, or months after someone have got TBI. And these secondary injury progressions combined together can lead to neuronal cell death in the brain. Okay, and that might make someone's more, well, I guess the symptoms worsens, right? If secondary injury is not prevented. Okay, so far makes sense? All right. Okay, so at the clinic, what happens if a patient is admitted for traumatic brain injury? Usually, doctor will perform this, Glasgow Coma Scale. We call it GCS scale to see your responsiveness with your eye, your motor response, and your verbal response. So they have these indications of score. The highest the score, I think within the range of 15, right? Combine of this. The better you are, actually, the more responsive you are, right? Okay, so as I explained, the key mechanisms here, following secondary injury neuroinflammation and oxidative stress are the main mechanisms that I'm interested in, right? Which we study here, in the lab, all right? And there are other secondary injury also that are, linked to each other. So, but I explain to you a little bit later. All right. So also, just to tell you, there are specific proteins that we are interested to study. These are the CGAS, STING, type 1 interferon productions in the brain. So I will explain to you why. So because I like to understand the cellular events after traumatic brain injury, so we actually identify this mechanism as the major contributor to the neuroinflammatory response following traumatic brain injury. Okay, so this is the type 1 interferon production, the cytokines that are released that make the inflammatory response worse after traumatic brain injury. Do you understand the concept of inflammation, right? So you got inflammation also because of the injured cells in your system, right, that release these cytokines. And usually inflammation is supposed to be protective, right? It's supposed to help you heal, but if it's overactivated or chronically activated, that it might cause more damage to the environment of the cells. So this is what we call neuroinflammation, inflammation of the brain, right? Okay, so just bear with me, right? So these are very, very, I guess, messy diagram because there's so many things happening. Right, you learn about the types of the brain's cells. We have the neurons, right? We have the neurons here, and then we have the microglia and astrocytes. So once there is a neuroinflammatory response in the brain, in this case, for example, when the brain following traumatic brain injury, it will activate the microglia to release cytokines, right? This is acute neuroinflammations, right? Over time, if it's not being resolved, it will develop to chronic neuroinflammation, and this will actually activate all the other mechanisms like autophagy dysfunction, right? Autophagy dysfunction. You know what autophagy is? Cellular recycling process, right? Of the cells, and then oxidative stress will increase, right? And apoptosis, programmed cell death also being activated. So these are very mechanism study, right? So we are very interested to understand what are the instigator, what actually make this chronic neuroinflammation, and that's why I said just now we are targeting this protein called SIGA-STING, right? STING protein. I will explain to you. Okay, so we think that STING is activated after traumatic brain injury because of the release of self-DNA from injured cells. Right, you learn about infections that the viral DNA can actually activate these STING pathways when it is infecting, the cells. But people also found the self-DNA that release after cells are injured can also activate. This is actually my work with Melbourne, but I will show you later. All right, we are very interested in the type 1 interferon dysregulation and in TI, but the reason why. But if you want to become a scientist, you always have to ask question why, right? Why do you study this, right? Why do you study that? So the basis of our study is because they are found the involvement of type 1 interferon in this disease brain, right? And then, so these are the first from the humans TBI patient to show increased expressions of this type 1 interferon beta actually after traumatic brain injury, right? But upregulation and downregulation doesn't mean anything if you don't actually study, right? But it says something. It says that this protein actually involved in this TBI. Okay, so these are the animal models of traumatic brain injury. Actually, I know that there's some veterinary student here, right? Is it? So when you do research in animal models, obviously it involves ethics, right? You can see from here we actually use this wild type and if not knockout mouse, okay, mouse that doesn't have the type 1 interferon signaling. You can see the mouse without type 1 interferon signaling have a reduced lesion size, right? You can see from here as compared to the wild type, okay, the normal mouse. Right, what does that mean? What does that mean? If you think about what does the type 1 interferon do to the lesion size, the injured area of the brain after traumatic brain injury. Is it a bad protein or a good protein for TBI? Is it bad? It's bad, right? Because if it's there, this is the wild type, the normal. If type 1 interferon is there, the lesion size is bigger. If it's not there, it's smaller. Make sense? Right? Okay. So just bear with me. But then we found that type 1, if you remember, right, the type 1 interferon is actually downstream. Right, sorry, this is downstream, right? After STING. So if we think that type 1 interferon is involved, so how about STING involvement? STING is the upstream activator of this signaling. Okay, so then we think that STING might be involved in influencing type 1 interferon production after traumatic brain injury, and that's why we look at the STING protein here. You can see, right? So similarly, okay, I will show you now. These are just briefly the in vivo study that we do. Right, if you want to do any animal models of brain disorders, right, you need to use animal models, right? Can you ask someone for their brain, human brain? Are they going to give you their brains? Most likely not, right? You might get a post-mortem human brains to study, but that's why you use animal model. So for traumatic brain injury model that we did use is called CCI, cortical impact, right? You can see from here that you actually take out the brains of the mouse. Actually, they are still alive. You knock them down, you put them to sleep, and then you remove the skull. You specifically injure these parietal regions of the brains on the right side of the brain. Right. So this will mimic uh, mild traumatic brain injury. Okay. So then we look at this sting protein. So we found that the sting is highly upregulated after traumatic brain injury. You can see from here, right? This is the late trauma injured sites of the patients who die after traumatic brain injury as compared to control. So this is the first data actually to show sting is highly expressed in the brain after traumatic brain injury, and we were the first group who showed this in the world, right? And subsequently, other researchers pick up the study and they show sting expression in, you can name any types of brain disorders. They found that sting is highly expressed in brain injury. So this is why until now I'm still, okay, right. Okay, so just to show you, there's a increased activation of sting as well after traumatic brain injury in the mouse model. This is using Western blot, right? I'm not sure if you have encountered this some sort of analysis, but this is just to detect expression of protein, right? Using Western blot. Okay, we also published this paper to show that sting is activated after traumatic brain injury using the mouse model of TBI. You can see, and we show that without sting, it is actually better protective, right? Okay, so we also show that sting is activated after hydrogen peroxide treatment, which is using in vitro cell culture studies, right? As you can see from this diagram. Basically, when you do molecular mechanism, you want to do in vivo or in vitro studies, right? Using mouse model or cell culture. And this is how you do it. I'm not going to bore you with the data so much, but you can ask me if you want to know more, right? But just to give you an example. Okay, and we also show that there is a multifaceted role of sting, right? Because when we use in vitro cell culture, actually sting is protective, not detrimental to H2O2 induced cell death. These are the in vitro cell culture model for oxidative stress. So what happens if you actually pharmacologically inhibit sting? Because the data shows sting is bad, right? So if you actually use some drugs to inhibit sting activation, what happens? What do you think will happen after traumatic brain injury? Anyone want to give it a go? Try. To my question.
Ada adik-adik yang bisa menjawab apa yang bisa terjadi setelah traumatic brain injury? Kalau ada, boleh tunjuk tangannya.
Kalau you block sting activation guna drugs, what will happen?
Jadi kalau ada pembekuan darah, kira-kira apa yang bakal terjadi itu? Ayo, ada yang bisa menjawab? Kira-kira? Davin bisa jawab? Oke. Nah, boleh.
Correct, right? So someone is following my okay, because sting is actually induced chronic neuroinflammation. So if you use drug, then it will reduce. It's supposedly you know, the hypothesis, it will reduce neuroinflammatory response. Okay, so the new, this is a new data, I mean recently published as well. We use the C176 inhibitors of sting in the animal model. You can see the progression of my data as well, right? Before it was TTC staining, now we have MRI images to understand the lesion size. So you can also know with science, it depends on the technology and also the money that we have in the lab to perform all this analysis. You can see there's a reduction in the lesion size after sting inhibition. Okay, So we actually use a digigate. So I'm not going to bore with you. This is another example to understand motor function after traumatic brain injury. So you look at the behavioral analysis. But similarly, the inhibition of sting using this drug 26 improve behavioral outcome after traumatic brain injury. And you can read this data, read this paper if you're more interested in this kind of study. Okay, so now at Sanwi University, I'm still so much interested in sting pathway because it is a robust pathway that is activated, you know, powerful activation of these pathways after brain injury. So you can see these are the so far a lot of researchers have found that sting is involved in various activity involving brain disorders, I guess, and it is activated because of the release of the self DNA or any molecules that are contribute to the brain pathology. So usually what we do, we want to screen for neuroprotective compounds, right? In Indonesia, you have a lot of natural product, right? So you can use all of these, I guess, compounds to try to test and understand whether they are protective or not in brain injury, and this is what we try to do. All right, so you do TBI or information using UPS, right? And then you try to look at the lesion size and behavioral outcome of the mind, right? Okay, you can also do in vitro or in vivo models, all right, using the mouse or zebrafish actually in the lab. Okay, I think there's some, do I have time still? 5 more minutes, okay. I just want to show you some of the compound, also natural product that we study. Actually, also Budi doing some of the research in the lab. Right, the gold compound. All right, I've explained to you about this. So just to show you this gold compound, right? This is H2O2 induced cell death, in vitro cell model for oxidative stress. You can see without H2O2, a lot of cells die. Sorry, with H2O2, the cells die. But when you co-treat with this gold compound, it does show increased cell viability. So these are cell viability, right? So it shows that gold compound is actually protective. All right, similarly in BV2 cell lines, I think just now is in the neuroblastoma cell lines, right? So they have some neuroprotection there. Okay, this is just in vitro cell culture model, right? And then we also have the kappa pisces cerevisiae. This is right. We want to test whether seaweeds are also neuroprotective. The data shows is quite promising. There's a neuroprotection here, right? And these are some of the data that my students also recently did, right? With the increased concentrations of the seaweed. So there is a trend of neuroprotection. But these are the fermented. This is not unfermented, doesn't show any effect. All right. Okay, these are black ginger. We also have some positive data for the black ginger, as you can see from here. All right. And Budi is doing a pitaya extraction. Pitaya is dragon fruit, buah naga. Okay, buah naga. So we get the peel of the buah naga and we try to understand whether it has some protections in our model. And it does have some protection, you can see from here. Okay. All right, any questions? Maybe I should stop here, but I think I've given you some overview of the research that we do. If you're more interested, if you want to know more, you can come to see me. I am happy to help, right? I think it's important for you guys to be interested in research, right? Even though you are medical doctors. And I can tell you there are so many opportunities in the world to actually, do research, right? I think we have the brains. You are all brilliant students, right, of UNP. So you have to develop this critical thinking as a scientist if you want to grow. Okay? I think that's all from me. And thank you so much to the organizers to having us today. So just to touch a little bit in terms of what AI can do for our research, right? You see that we do heavy experiments in the lab to screen all these compounds So maybe using AI, machine learning, you can actually have the data, library data that can, predict the effects of certain drugs or compounds that you test, like a screening platform. Right? So that might be the future ahead with the use of AI. I think it will help a lot of research in the lab. Okay. All right. Thank you so much. Then I think that's all from me.
Okay, thank you so much, Dr. Amar. Thank you for the very interesting presentation. And we know that after traumatic brain injury, our body produces a pro-inflammatory cytokine that following the traumatic brain injury in a chronic way. And session will be presented by to Mr. Budi. Time is yours. Mungkin kalau dari Pak Budi boleh dari pakai bahasa Indonesia juga nggak masalah. Karena Pak Budi ini dari Universitas Airlangga. Nanti setelah ketiga speakersnya mempresentasikan, adik-adik boleh mempersiapkan pertanyaan. Nanti ada 2 pertanyaan bagi adik-adik yang bertanya. 2 orang akan ada hadiah dari Dr. Mutia. Silakan ditunggu hadiahnya. Jadi silakan siapkan pertanyaannya. 2 orang penanya ya. Terima kasih.
Oke, halo semuanya, selamat pagi. Masih semangat ya? Halo. Kita santai saja. Ini tidak seberat dari 2 materi sebelumnya. Sini. Halo. Jadi di sini saya cerita terkait pribadi ya. Jadi materi yang saya bawakan ini adalah pursuing a PhD abroad, academic, cultural, and personal challenges. Jadi topiknya. Sebelum saya mulai, boleh apa ada mahasiswa di sini untuk lanjut studi? Boleh angkat tangan? Apa ada yang pingin lanjut studi, punya cita-cita lanjut studi, pingin keluar negeri atau gimana? Ada? 1, 2, 3.
Semuanya harusnya pengen lanjut studi ya. Boleh diangkat tangan semuanya, kan pengen lanjut baik spesialis maupun S2,
betul.
S3.
Spesialis juga termasuk karena bisa ya meningkatkan kompetensi ya. Ya bagus, terima kasih banyak. Kalau tidak ada yang angkat tangan, saya tidak perlu untuk memberikan materi. Terima kasih. Yang pertama, jadi yang pertama saya akan mulai untuk dari pertanyaan. Is doing a PhD abroad only about the research or publication? Karena ekspektasinya ketika Anda melihat seseorang studi lanjut S3, yang kita lihat pada umumnya adalah dia akan melakukan research, ya, dia akan publish artikel, kemudian dia akan ikut conference, ya, kayak orang ini. Dia senang ikut conference. Tapi kalau kita lihat lebih jauh lagi, kalau kita telisik, misalnya ada seniornya yang kuliah di luar negeri, terus kita mengintip, oh dia punya Instagram atau dia punya LinkedIn, biasanya yang diupload adalah traveling, terutama yang ke luar negeri. Jadi rasanya kalau kita lihat orang yang lanjut studi di luar negeri, mereka terlihat seperti sangat-sangat bahagia. Ya. Itu yang biasanya kita sosial media. Nah, selanjutnya apa sih yang sebenarnya ada di belakangnya atau apa tingkat tidak perlu diekspos? Biasanya kita tidak semua eksperimental itu berhasil. Jadi seringkali terutama pengalaman master dan juga S3 itu seringkali mendapatkan kegagalan dalam eksperimen. sesuatu yang wajar, sesuatu yang sangat normal, yang kita harus terus berusaha. Jadi seperti itu. Tadi saya sampaikan ada salah satunya adalah publish paper. Tapi sebelum kita publish, saat kita berusaha untuk apply atau saat kita atau hasil penelitian kita seringkali juga mendapatkan penolakan. Jadi itu juga merupakan normal, hal yang biasa. Kemudian lagi yang biasanya kita tidak lihatkan di sosial media karena kita ini yang bagus-bagus ya. Ada salah satu PCR. Tahu ya PCR itu apa? Ya, waktu COVID kan sangat terkenal polymerase chain reaction. Ya. Tapi waktu kita melakukan PCR, saya dan beberapa teman waktu master, ketika hasilnya baik, maka PCR itu adalah polymerase chain reaction. Tapi kalau misalnya hasilnya kurang baik, maka dia akan jadi PCR, pipette, repeat. Terus mengulang, kita harus optimasi. Apa harus ikan? Oh, enggak. Ini hal yang biasa saja. Ini halo. Halo, maaf ya. Saja, this is fine ya, walaupun di sini ya masalah. Karena kita biasanya sebut itu sebagai optimisasi ya. Kita optimize semuanya yang ada di penelitian kita. Nah, di sini saya mau perkenalkan diri dulu. Jadi saya background saya ya. Saya di bidang farmakologi, terutama di neuroscience. Sekarang sedang menempuh S3 di Surgery Medical School di Sunway University di Malaysia. Jadi ini journey saya ketika saya Sunway. Jadi supervisor saya adalah Prof dan juga Dr. Amar. Jadi dulu ceritanya saya diminta untuk jadi salah satu panitia di conference. Saya mengikuti conference di universitas saya dulu di Airlangga. Kemudian di sana ternyata saya bertemu dengan Prof Long. Kemudian kami berbincang-bincang, itu tahun 2023, Liang Conference. Ini kalau misalnya ada conference atau ada kuliah tamu internasional itu sangat-sangat baik untuk Anda semua untuk bisa menjalin kolaborasi atau dapat menemukan calon supervisor. Karena pengalaman saya pribadi, saya banyak ketemunya di sini, conference ataupun ada kuliah tamu dari luar. Jadi seperti itu. Manfaatkan peluang-peluang tersebut. Kemudian saat itu kami bicara dan ternyata ada peluang untuk S3 di Sunway. Kemudian ada juga peluang untuk beasiswa, jadi sangat-sangat menarik. Akhirnya setelah saya lulus 2024, saya coba untuk apply, kemudian tentu selanjutnya ada interview, kemudian tahun 2025 akhirnya saya menjadi mahasiswa di Sunway University dan sampai sekarang. Akhirnya jadi kayak gini. Selama perjalanan ini apa sih yang saya ingin cerita terkait dengan mana apa ya hal-hal penting ataupun challenge yang saya alami. Jadi seperti itu. Yang pertama adalah academic system defense. Jadi terutama ketika kita berbicara level S1 maupun yang level postgraduate yang S2 atau S3, perhatiannya berbeda. Jadi sudah S2 terutama S3 lebih independen, ya, risetnya lebih independen. Jadi tidak selalu bergantung pada supervisor, tidak seperti yang S1. Kemudian kita dituntut untuk bisa berpikir lebih kritis. Jadi tidak hanya menerima, oh ini protokolnya seperti ini, tapi kita harus bisa mengetahui prinsipnya seperti apa, kemudian dengan kritis kita melihat dan mengoptimasi, menyesuaikan protokol itu dengan penelitian kita. Jadi seperti itu. Kemudian tentu ada tuntutan untuk diseminasi atau seminar terkait dengan penelitian kita. Kemudian apa tantangannya dalam hal ini? Ya tentu kalau kita lakukan penelitian kadang berhasil. Kemudian menyesuaikan juga karena kalau misalnya kita lakukan penelitian tentu butuh uang dan kita harus menyesuaikan dengan fasilitas yang kita punya, penelitian yang kita inginkan. Jadi seperti itu. Jadi kita sudah berpikir sampai ke arah sana untuk penelitian S2 atau S3. Kemudian tentu kebutuhan untuk publikasi biasanya untuk S2 atau S3 di Unair biasanya S2 perlu untuk publikasi untuk kelulusan. Jadi seperti itu. Di beberapa universitas juga sudah diwajibkan untuk publikasi. Kemudian challenge yang terakhir tentu time management karena berbeda kalau S1 mungkin kuliah ya, kuliahnya banyak, tutorialnya banyak, tapi kalau S3 kita terutama yang by research kita full penelitian, jadi kita mengatur waktu kita sendiri. Gitu. Nah, kemudian tadi kan banyak tantangannya, gimana caranya bisa survive? Kita bisa bangun relationship yang kuat dengan supervisor. Ya, saya beruntung punya supervisor Dr. Amal dan Prof Long, sering diajak makan. Ya ini fotonya. Kemudian kita harus banyak berbicara, berbincang, komunikasi dengan lab member, dengan teman-teman kita, karena kita akan selalu bekerja sama dengan mereka. Kalau misalnya butuh apa-apa, tentu komunikasi yang utama. Gitu. Kemudian manajemen waktu, ya, karena seperti yang saya sampaikan tadi, kita perlu mengatur waktu kita sendiri. Jadi dibuat jadwal, walaupun misalnya tidak sempurna, tapi kalau misalnya bisa membuat jadwal, itu akan sangat membantu, lebih terarah. Kemudian seek help early. Jadi kalau misalnya ada kebuntuan, ada masalah, segera untuk minta bantuan atau sekedar cerita terkait dengan apapun, tidak hanya terkait riset, tapi apapun itu dengan orang lain ataupun supervisor. Jadi kalau saya sih itu yang saya lakukan. Ya, ini salah satu kegiatan teaching contribution yang saya lakukan di Sunway University. Kemudian yang kedua, kalau misalnya kita keluar negeri atau daerah gitu ya, tentu ada perbedaan budaya gitu ya. Perbedaan budayanya biasanya kita honeymoon dulu. Jadi kita punya ekspektasi yang cukup tinggi. Oh, saya mau ke daerah ini. Oh, dia punya pulau yang indah dan lain-lain dan sebagainya. Oh, orangnya ramah dan lain-lain sebagainya. Kemudian kalau misalnya ekspektasinya terlalu tinggi, mulai frustasi karena tidak sampai tuh ekspektasinya. Kemudian baru mulai adaptasi, adjustment, ya, dan dilanjutkan dengan adaptasi. Akhirnya kita bisa merasa nyaman dengan kondisi yang ada. Biasanya fasenya seperti ini, jadi seperti itu. apa saja yang menjadi aspek dari culture shock ini? Biasanya itu adalah komunikasi, ya. Karena kalau misalnya ke Malaysia tentu agak mirip ya bahasanya, cuman tetap kalau di Sunway tetap pakai bahasa Inggris. Kemudian karena kita sebagai international student, kalau misalnya ke luar negeri ke Jepang mungkin harus belajar bahasa Jepang, Korea harus belajar bahasa Korea seperti itu ya. Kemudian classroom interaction tentu berbeda ya. Jadi kalau misalnya waktu orientasi misalnya, oh kakak tingkatnya minta pertanyaannya yang kritis ya, sampai nggak ada yang nanya gitu. Tapi kalau di sana lebih terbuka, jadi apapun kesempatannya diambil, jadi seperti itu. Kemudian food and lifestyle, tentu ya makanannya berbeda, ya harus adaptasi terkait dengan itu. Kemudian bagaimana caranya kita survive, ya harus dinormalisasi. Kita tidak bisa merubah budaya orang, jadi kita yang beradaptasi. Ya. Kemudian build a support system, kita bisa make a friend dengan lokal atau international student di sana, kita bicara berhubungan baik dengan mates, kemudian bisa juga join community. Jadi kalau misalnya beruntungnya, kalau misalnya kita keluar negeri, di daerah manapun itu, di negara manapun itu biasanya ada PPI atau Perkumpulan Pelajar Indonesia. Jadi dia punya komunitas, bahkan ada. Kemarin saya ke Taiwan, di sana ada sangat kuat komunitasnya. Jadi ini salah satu di Sunway itu ada Perkumpulan Indonesia Sunway. Jadi ini Instagramnya, dia punya berbagai macam kegiatan di sana, termasuk kalau misalnya rindu Indonesia, dia punya banyak pilihan tempat makan kayak gitu. Kemudian juga aktif join kampus event, aktif itu akan lebih banyak teman, lebih banyak peluang untuk bisa kolaborasi. Ya, salah satunya ini kemarin saya bisa berpartisipasi di jadi FYP Year Project grad di sana, presentasi poster. Jadi saya bantu di sana. Kemudian ini juga untuk acara scholarship. Kemudian personal